second clinical practice stream of SNOMED CT Expo 2020. My name is Nick Egerhaus, and I will be moderating today's session. Please use the Q&A box to type your questions to the presenter. All questions will be answered at the conclusion of the presentation. I'm now pleased to introduce Isabel Meneses, who will be presenting using SNOMED CT as an interface terminology for the allergies, immunizations, and major surgeries sections in the patient summary. Isabel, please proceed.
Good afternoon, everyone. I hope you are healthy and safe. I'm representing the integration platform for citizen services and care at SPMS, and I will guide you through a practical use case of the Portuguese Patient Summary. We will see that with resource to SNOMED CT catalog, these tools will contribute to the citizen empowerment and provide health professionals with life-saving information. These sessions will be divided into 3 chapters: Portuguese context, using SNOMED CT in patient summary, and record patient allergies using SNOMED CT, that will be presented by my colleague Cristiana Maia. Let's begin with a brief context of the Portuguese context. So, our institution belongs to the Portuguese Ministry of Health alongside with other entities as the DGS, which is the clinical guidance, ACSS, which is the financial and the ruler, and SPMS, we are responsible for the IT governance and the technical implementation. So, we are a public enterprise, and our mission is to centralize, optimize, and rationalize resources in these 4 areas: purchasing and logistics, financial services, human resources, and IT. Here we can see our geographic situation between Lisbon and Oporto areas. And now a few numbers. We are 10 million citizens, we have 54 public hospitals, 359 primary care units, and SPMS runs 90% of the information and communications technology solutions in the country. So now, looking at our use case using SNOMED CT in patient summary, to better understand its application, let's review some market trends that are influencing the different industries. We have artificial intelligence, virtual reality, or big data. And looking now at some health trends that are also shaping our reality, we can see precision medicine and genomics, IoT, remote patient care and telehealth, and individual plan care. So, the patient summary is aligned with these trends, and it represents a single clinical document that aggregates the essential information that a health professional can use in an urgent care, remote or face-to-face. So this picture on the right represents the different databases that generate each section of the patient summary document. We can see not only clinical information, but also some demographic data. In this slide, we have some key benefits for both patients and also health professionals. For instance, for patients, it improves the information flow. It allows the access to health records in each country and also in the European Union. And for health professionals, it allows to summarize relevant information in a single, up-to-date document. To better assimilate, we brought you a short video of the patient summary. Enjoy! So we can see that the patient summary is like a suitcase full of health records. The service is already live in 4 countries, but the plan is to expand to all the European Union countries. So now, diving into the document itself, the patient summary has 6 sections of information. 3 of them using SNOMED CT application, the allergies, the immunizations, and the major surgery section. In this slide, we can see how it looks like an example of the allergies and the immunization section. And here, the major surgery section example. So, what was the job done regarding the SNOMED CT application in terms of the section allergies? We have created at SPMS a CTC, which is the Portuguese Clinical Terminology Center, and we adopted the CPARA catalog. So the table here presents an example of the SNOMED CT and its English and Portuguese correspondent designation. Here we can see in detail the type of classifications of each SNOMED CT code. We have 253 codes, and it took us around 1 year to complete this mapping. Moving now to the immunization section, the exercise was similar. We adopted the SNOMED CT codes and prepared 77 immunization codes. This job was done between the end of 2016 and mid-2018. The last section, the major surgeries, whenever we are using the International Patient Summary, we already adopt the SNOMED CT in the Master Value Set catalog. However, in Portugal, our surgeries are mapped with ECD9-CM and ECD10-PCS. So currently, we are developing a few national mapping rules, and our mid-plan goal is to complete the SNOMED CT mapping in this patient summary section. Summing up with some numbers, we have currently around 94,000 Portuguese citizens that have already subscribed their patient summary. And using SNOMED CT, we were able to map 280,000 allergies records and around 150 million immunization records. For the surgery section, we estimate a considerable number of resources due to the high number of surgeries that take place annually in our country. Finally, I will leave you with the patient summary roadmap. Here, we can see that the plan is to continue to structure the health data, add more information, improve the compliance with European specifications, and add more platforms like the mobile. We are also working in order to increase the sections in our documents, such as laboratory analysis.
Thank you for the presentation, Isabel. I'm now pleased to introduce Cristiana Maia, who will be presenting recording patient allergies using SNOMED CT. Cristiana, please proceed.
Hello everyone, my name is Cristiana Maia. As Nick indicated, I will present how patients can record allergies using SNOMED CT. At SPMS, I'm the project manager of electronic health record area. Here in Portugal and in other countries, users' health data are dispersed across different information systems, which often prevents informal healthcare provision, as health professionals end up not having access to all the information they need. So, with all these constraints to access to health information, the concept of electronic health records emerged. In Portugal, when a health professional, in this case a doctor or nurse, accesses the electronic health record, it can see all the interactions that the user has with the National Health Service, and in the case of hospital health episode, it can see the detail of that episode, no matter where in the country you are consulting this information. It is important to note that this information is not kept in a single place. That is, when the health professional has access, the system will search for this information in real time, and when the electronic health records of that user is closed, the information goes back to all places of origin locally, which are in the previous points of the country. The citizen area is the portal where the user access to view all interactions he has with the National Health Service, including future consultations in primary health care and hospital care. The clinical data is collected electronically and individually. Access to the citizen area is through the citizen card or with a digital mobile key. Digital mobile key is a simple, fast, and secure form of access, and the digital mobile key allows access to other public administration portals. It is a means of transversal authentication. One of the functionalities that the citizen area provides is the patient summary. As mentioned by my colleague Isabel previously, minimum essential information for the provision of urgent or unscheduled health care. According to the new data protection regulation, the user himself has to allow access to his patient summary so that the health professional can consult it. All information from the patient summary is generated in real time for consultation and is not stored in a single location, but in the different locations that are the source information systems. So, now let's watch a short video on how to activate and access the Portuguese Patient Summary. This functionality has been available for about 2 years. We are still working on communication and dissemination of this information, but overall the results have been very good. In the citizen area, we also have a section where the user can proactively post their allergies and share with the health professionals. We are currently working in the implementation of SNOMED CT. Soon we will also launch a new version of the citizen area where we improve accessibility, usability, and navigability, and we will then evaluate whether all these improvements will make users register more easier to access their health information, including data like allergies. Here we can see some numbers of the use of the citizen area. We currently have over 2,300,000 registered users in the citizen area. So, as a sum up, with the patient summary, we are enabling more informal healthcare provision, allowing access and consultation across borders in a universal language, and we give the user the power to manage their information, allowing them to indicate to whom they want to give access to this information through citizen area. We are certain that the use of common language in healthcare information provides a better and life-saving healthcare service. So, thank you very much for your attention, and we are now ready to hear your thoughts about this. Thank you.
Thank you, Cristiana, for your presentation. Can I ask that attendees give us a moment while we switch over from our pre-recorded content so that Isabel and Cristiana can address the questions you've been submitting live. Please also note that this session will be available on the event platform for the next 3